Ladies and gentlemen, a warning from the world of quiet tragedies. Most people do not lose their sight with a bang. They lose it like a dimmer switch, one slow click at a time. And after age 60, when the eyes already have plenty of enemies, there is one more that slips in wearing a disguise. Not a cataract, not glaucoma, not even that famous villain, macular degeneration. Something smaller, something preventable. A missing piece of nutrition that can make the difference between seeing the world clearly and watching it fade.
Okay, here's the deal. This video is called, "Without this vitamin, vision loss risk increases after 60." And I'm not saying vitamins magically cure everything. I'm saying there's one specific deficiency that can quietly mess with the wiring of your vision, especially as you get older. It's vitamin B12. And yes, vision loss from B12 deficiency is not the most common cause of vision problems in seniors, but it is one of the most tragic because it can be preventable and sometimes treatable if you catch it early. Here's the scary part. Most people do not realize it's happening because it's often painless, often in both eyes, and it creeps in slowly. You might blame your glasses. You might blame getting older. You might wait. And waiting is where the danger lives because nerve tissue is not forgiving if you let it run too long. So today we're going to do three things. Explain what B12 does for your eyes, why the risk climbs after 60, and how to protect yourself without doing anything dumb like megadosing blindly.
Vitamin B12, once a mysterious factor hidden in liver extracts, became famous for rescuing people from pernicious anemia, a once devastating illness. But history has a funny habit. It introduces a nutrient as a hero for one problem, while its other jobs remain backstage. It helps build blood. It helps maintain nerves. And the optic nerve, that precious cable connecting eye to brain, is not the kind of tissue that enjoys being underfunded.
Let's make this simple and visual. Your eyes are cameras, but your optic nerves are the data cables. Vitamin B12 is part of the maintenance crew that keeps those cables insulated and functioning. Specifically, B12 supports the nervous system and helps maintain myelin, which is basically the insulation around nerves. When that insulation breaks down, signals do not travel cleanly. So what can happen with prolonged B12 deficiency? A condition called nutritional optic neuropathy. Translation, the optic nerve starts failing because it is not getting what it needs. This tends to be gradual, typically affects both eyes, and can show up as blurry central vision, reduced sharpness even with the right glasses, and colors that look washed out. Some people describe it like someone smeared grease on their lenses, except cleaning the lenses does nothing. And here's the key point. If B12 deficiency is found and treated early enough, you can often stop progression and sometimes regain part of what was lost. But if the optic nerve fibers atrophy for too long, recovery may be limited. That's why this topic matters.
Consider the stage, aging. Vision impairment becomes more common with every decade. In the United States, more than 1 in 4 adults over 71 has some form of visual impairment, and older adults make up the majority of severe vision loss cases. The public hears about cataracts, glaucoma, and macular degeneration, and rightly so. But the old radio hosts of medicine would remind the audience, sometimes the culprit is not in the eye's lens or pressure, but in the body's supply lines.
So why does the risk of B12 deficiency go up after 60? Usually, it's not because you suddenly forget how to eat. It's absorption. To absorb B12 from food, your stomach acid helps release it. And your stomach also needs to produce intrinsic factor, which helps you actually take B12 in. With aging, some people develop atrophic gastritis, meaning the stomach lining thins and acid production drops. Less acid, less extraction. Less intrinsic factor, less absorption. Same steak, less B12 reaching your bloodstream. Then there's the medication effect. A lot of people over 60 are on acid reducers for reflux, like proton pump inhibitors or H2 blockers, and lower stomach acid can reduce B12 absorption over time. Metformin, commonly used for type 2 diabetes, is also linked to lower B12 levels in some patients. Depending on how deficiency is defined, estimates suggest roughly 5% to 20% of older adults may have at least mild B12 deficiency, and some reports in seniors show even wider ranges depending on the testing method. Translation, this is not rare enough to ignore.
The thief does not kick down the door. It picks the lock. A slow fade, a quiet blur, a dimming of color. And because it arrives wearing the mask of normal aging, people often accept it without protest. In the golden era of radio dramas, this would be the moment the narrator leans in and whispers, "The danger is not that the problem exists. The danger is that you do not suspect it."
Let's talk about early warning signs people miss, because this is where you actually win. Early B12-related optic nerve issues can feel like your vision is slightly blurred even with your normal correction. Reading feels harder unless lighting is perfect, and your central vision feels less crisp. Another big clue is color and contrast. People notice reds look dull, blues look grayish, or everything feels washed out. That color fading thing is classic for optic nerve stress. Some people also notice low light struggles, like walking into a dim room and needing longer to adjust, or feeling less confident driving at night. Now, I'm not saying every night driving issue is B12. Cataracts can do that too. But if it's worsening, unexplained, or paired with other B12 clues, it's worth investigating. And here's the sneaky part. It's often painless. It triggers procrastination. Rule of thumb: if your vision is changing and the explanation is unclear, do not let its just age be the final diagnosis. Treat it like a mystery until proven otherwise.
A clarification delivered with the gravity of a broadcast interruption. B12 deficiency is not the leading cause of blindness in older adults. The heavy hitters remain age-related macular degeneration, glaucoma, cataracts, and diabetic eye disease. But the importance of a rare or uncommon villain is not in how often it appears, but in what happens when it does. This villain is preventable, and in storytelling, the preventable tragedy is always the one that haunts the hardest.
Who should actually worry about B12 deficiency? Here's the practical risk list. First, older adults with low animal food intake. B12 is naturally found in animal products like meat, fish, eggs, and dairy, plus fortified foods. If someone is vegetarian or vegan without reliable B12 sources, risk rises over time. Second, gut problems. Crohn's disease, celiac disease, chronic gastritis, and especially history of bariatric surgery or intestinal surgery can impair absorption. Third, long-term medication use, acid reducers, and metformin are the big ones. Fourth, pernicious anemia, an autoimmune condition where the body stops producing intrinsic factor. That can cause significant B12 malabsorption and neurological problems even before anemia is obvious. And fifth, chronic heavy alcohol use, because it often goes hand in hand with poor nutrition and multiple vitamin deficiencies. Historically, doctors even described tobacco-alcohol amblyopia, where nutrition plus toxins wrecked vision. If you recognize yourself in any of these groups, this is not about fear. This is about being smart. You are playing a game with known risk factors, so you check the scoreboard.
Long ago, clinicians observed a peculiar pattern: vision dimming in people whose diets had collapsed under the weight of addiction and poverty. They described it in the language of their time, linking it to tobacco and alcohol. But later, science revealed the deeper truth. The optic nerve was starving. B vitamins were missing. The signal line from eye to brain was failing, not with drama, but with slow surrender.
Now the action plan. Step 1. Test. Do not guess. A simple blood test can check vitamin B12 levels. If the result is borderline and symptoms suggest deficiency, clinicians sometimes add markers like methylmalonic acid or homocysteine to see whether your body is functionally short on B12. That matters because some people have normal-looking B12 but still act deficient at the tissue level. Step 2. Find the cause. Is it diet, absorption, medication, or autoimmune pernicious anemia? Because the fix depends on the reason. If it's diet, oral supplementation plus food changes might be enough. If it's absorption failure, you may need higher dose oral B12 or injections to bypass the usual pathway. Step 3. Treat consistently. Many protocols use high-dose oral B12 like 1,000 micrograms daily for repletion, then a maintenance plan. In more severe or malabsorption cases, injections are often used, sometimes weekly for several weeks, then monthly. The exact schedule depends on severity and cause. And step 4, do not do the classic mistake, stopping early because you feel better. Nerves heal slowly. Vision recovery, if it happens, can take months. The goal is stop the slide first, then see what can be regained.
The optic nerve is not like skin, quick to mend. It is more like an old telephone wire stretched across a stormy field. Repair is possible, but only if the line has not snapped beyond recognition. Catch the deficiency early, and the story can change. Ignore it too long, and the best you may achieve is preventing further loss. In the theater of biology, timing is not a detail. Timing is the plot.
Prevention and diet. Without turning this into a cookbook, if you eat animal products, the main B12 sources are meat, fish and shellfish, eggs, and dairy. Some fortified cereals and fortified foods also contain B12, which can help, especially when chewing or appetite becomes an issue in older age. But here's the catch. After 60, absorption from food can decline in some people, so I eat fine does not always equal I absorb fine. That's why the testing piece matters. The recommended intake for adults is about 2.4 micrograms daily, which is tiny on paper, but biology is not just intake, it is absorption. If you are vegetarian or vegan, you basically need a plan, not hope. Fortified foods and a dedicated B12 supplement are the usual strategy. Also, do not fall for the more is always better mindset. You are trying to avoid deficiency, not win a vitamin eating contest. And remember another trap, high folic acid intake can mask the anemia of B12 deficiency while nerve damage continues quietly. So if you supplement, do it intelligently, ideally guided by labs.
In the grand timeline of aging, deficiencies do not announce their arrival. The body can store B12 for roughly 3 to 5 years, which means the story often begins long before symptoms appear. A person may enter their 60s with a hidden deficit already forming. The moral, spoken softly in the vintage cadence, prevention is not a single heroic act. It is a quiet habit repeated until it becomes fate.
One more thing that boosts your accuracy. Connect the eye symptoms to the rest of the body. B12 deficiency often does not stay politely in one corner. People may also have fatigue, anemia, tingling or numbness in hands or feet, balance problems, memory issues, or a weird sense of brain fog. None of these prove B12 deficiency, but together with vision changes and risk factors, they raise suspicion. Also, do not confuse this with the classic vitamin A night blindness. Vitamin A deficiency can cause dramatic night vision problems and dry eye issues, but in most developed settings, it's less common in typical older adults unless there is severe malabsorption or extreme dietary restriction. B12 is the more realistic nutritional silent threat after 60 because absorption is a known age-related bottleneck and because medications like acid reducers and metformin are so common. If you want a simple checklist to remember, over 60, gradual blur in both eyes, colors less vivid, plus either gut history, long-term reflux meds, metformin, vegan diet, or unexplained neuropathy symptoms. That combination deserves a lab check, not a shrug.
The broadcast nears its finale, and the message sharpens. Vision loss is often portrayed as inevitable, a one-way road into blur and darkness. Yet medicine, like a good radio drama, loves the plot twist. Sometimes the villain can be unmasked. Sometimes the door can be locked before the thief enters. And sometimes a simple test and a simple treatment can spare a person from a preventable loss that would otherwise be mistaken for destiny.
Let's land the plane. The title says it plainly. Without this vitamin, vision loss risk increases after 60. That vitamin is B12. Not because B12 is magical, but because it supports the nervous system. And your optic nerve is nervous tissue. When B12 runs low long enough, the optic nerve can struggle. And that can mean gradual, painless, often bilateral vision decline with color fading and central blur. Most vision loss in older adults still comes from things like cataracts, glaucoma, diabetic damage, so do not self-diagnose. But do not ignore the preventable lane either. If you are over 60 and you have risk factors, ask for a B12 level. If you have symptoms plus risk factors, ask sooner. If it's low, treat it consistently and figure out why it's low so you do not play whack-a-mole with supplements forever. And if your labs are normal, great, you just ruled out a major preventable cause and you can focus on the real culprit with your eye exam team. That is not wasted time. That is smart medicine.
And so, dear listeners, the final note. The eyes may be windows, but the optic nerve is the wiring behind the wall. Keep the wiring nourished, and the light has a chance to stay bright. Let B12 slip away unnoticed, and the picture may fade when you least expect it. Stay curious. And when the world seems a little dimmer than it should, do not accept the darkness without asking why.